From the moment that we came here to Portsmouth Regional and the moment that I walked into the ICU to see Bob that first day, I felt comfortable. It was a really scary situation. I was an emotional mess with a lot of unknowns, and Dr. Massari, his whole team, Maddie, they held my hand the whole time. My name is Amanda Hoffman, and this is my husband Robert, and he was a patient here at Portsmouth Regional Hospital.
So what Bob experienced is a rupture of an aneurysm. What we noticed was an extensive amount of blood wrapping around the brain. And obviously the interaction with the patient is always try to gauge if there is already some neurologic deficit building up. Generally is associated with an extremely and severe headache, the worst headache you ever had in your life. My name is Francesco Massari. I'm a neurointerventionalist at Portsmouth Regional Hospital.
So the night that Bob had his brain aneurysm rupture, it was a normal Monday. Bob had been at work all day, had gone to the gym, and in fact was bragging at dinner because his class at the gym outperformed the rest of us during the course of the day. And we went to sleep as normal, and at some point in the middle of the night, Bob was snoring very loudly, and usually a nudge, you know, the whole elbow nudge works. But this time he was on his back and there was a gurgling sound with the snoring. And I was able to wake him out of that. He got up from the bed, went into the bathroom, and immediately started vomiting. He was complaining of a headache. This whole situation, as you can imagine, was an emotional overload. Not only was I dealing with an emergency situation, but it was something that I had never even thought could happen before, something I didn't know anything about. So there were always questions, and sometimes I didn't even know the right questions to ask. But Dr. Massari and his team were always right there, ready to answer a question, ready to draw me a picture and explain what was happening every step of the way.
But 1 over 50 individual in US is harboring an ruptured aneurysm. So it's an aneurysm that didn't present yet, but is sitting there and probably expanding through the months or through the years.
When Dr. Massari said that 1 in 50 people will have an aneurysm, that was shocking. Because I did not realize how prolific this condition is and how many people are actually exposed to this threat to their lives. Well, I tell people, I feel great. I feel fine. I don't feel like I have anything wrong. I've been exercising and riding my bike, and gone skiing. I feel like I don't want to say 100%, but pretty close to it.
I really feel that the whole team, they saved his life. I know that they saved his life, and I'm very grateful.
I am too.